and welcome to Math and More. Today we're going to be learning about the parts of the heart. So let's start with what the cardiovascular system is. The cardiovascular system consists of a network of vessels that circulate blood throughout the body. They're monitored by the action of the heart. So this includes the pumping and the pulse of the heart. Now that we have talked about the circulatory part of the system, we'll talk more specifically about the heart in this video. So let's continue on to the size and placement of the heart in our body. There's a lot of misconception about this, and we'll cover that. The heart is a hollow, muscular pump that circulates blood throughout the body. It is slightly larger than a man's fist, and it weighs about 3,300 grams. It is located slightly to the left of the midline of the body and is pear-shaped. Now to the three layers of the heart. The three layers of the heart include the endocardium, the myocardium, and the pericardium. The endocardium is the inner lining of the heart. The myocardium is a muscular middle layer, and the pericardium is the outer membranous sac that surrounds the heart. So this layer protects the heart. The four chambers of the heart include the right atrium, the left atrium, the left ventricle, and the right ventricle. The right atrium receives blood from all body parts except the lungs, and the blood travels via two large veins, the superior and inferior vena cava. The blood leaves the right atrium through the tricuspid valve at the bottom of the chamber and enters the right ventricle. So the four chambers of the heart also include the right ventricle, the lower right chamber of the heart. The right ventricle pumps blood out through the pulmonary valve into the pulmonary artery to the lungs. The right ventricle is separated from the left ventricle by a partition called a septum. So when the blood returns to the heart from the lungs, it is fully oxygenated and enters the upper left atrium. It leaves the left atrium through the bicuspid or mitral valve into the left ventricle. Both atrium chambers together are referred to as the atria. The left ventricle pumps blood out through the aortic valve into the large aorta artery and out of the rest of the body. All valves of the heart close to prevent backfold. The right ventricle is separated from the left ventricle by a partition called the septum. So we talked about this earlier as well. So moving on, let's learn about how the heart makes the heart beat. Well, the sinoatrial node is called the pacemaker of the heart. It is controlled by the brainstem and generates electrical impulses at the rate of 60 to 100 impulses per minute. Those impulses are distributed to the right and left atria, causing them to contract. If you watched our Parts of the Brain video, the link is attached in the description if you want to watch it. This was mentioned, and we learned about how the respiratory and cardiovascular system is controlled by the brainstem. The brainstem is also the only part of the brain that is not fully covered by the skull, meaning it is a very vital part, and we need to be cautious of that. So the atrioventricular node slightly delays the impulses from the sinoatrial node. So the atria finish contracting before the ventricles start contracting. The bundle of His conducts the electrical impulses through the heart. It extends from the AV node into the septum between the ventricles and then branches out to both ventricles. This causes both ventricles to contract. The rate of heartbeat can be affected by various factors, including emotions, smoking, disease, body size, age, stress, and environment. Our rates of the heartbeat change occasionally. The electrocardiogram, also known as ECGs or EKGs, records the heart's electrical activity and can be used to diagnose abnormalities. So we will be creating videos about some cardiological diseases, and in those we will include what the diagrams of those look like on ECGs and EKGs. We will also add a video about how to read EKGs and ECGs. Systolic failure is when the left ventricle cannot contract normally and push the sufficient blood into the circulation. The ventricle often dilates or becomes enlarged. So this is more of a size abnormality, or it's a heart abnormality. And although the heart failure can occur on either or both sides, it usually starts occurring on the left side. Diastolic failure is when the left ventricle cannot relax normally between contractions, so it can't properly fill with blood, and the left-sided heart failure leads to a buildup of fluid in the lungs and shortness of breath. This is known as dyspnea. Although heart failure can occur on both sides, it does occur on the left side first, so the same case. Right-sided heart failure is usually the result of left-sided failure. So blood flows back into the right side of the heart, causing edema of the ankles, distension of the neck veins, and enlargement of the spleen or liver. Heart failure is the most common type of cardiovascular disease. All of us have heard about heart attacks. While heart failure is a problem with the pumping of the blood through the heart, a heart attack is a blockage of blood to the heart muscle. This causes damage and possibly death of the muscle tissue. It is usually the result of coronary artery disease, where plaque has built up and eventually blocks the coronary artery. Now that you've learned about the parts of the heart and the roles they play, you can fill out this chart for practice on where each part is. This will help you recognize in a diagram about the part. So you can see the left ventricle and the right ventricle and all the parts in this. If you have any questions, please email us at madnessandmore@gmail.com. You can also ask a question in the contact form in the About Us section. Feel free to suggest topics that you would like to learn about. Stay tuned for more videos. Thank you for watching, and don't forget to like, share, and subscribe.